I'll quickly get to look at Colles fracture, and this aspect of Colles fracture is the mechanism. So, mechanism of injury is basically you are looking at uh, what are the possible things that could cause a particular injury. If you know this, you know that if a patient has this injury, the story that the patient will tell would actually be around what you know. So this is Colles fracture, and it's fracture that is around the wrist, you know, and it's usually caused by what? Primarily, the person was falling and they use their hand to support themselves. So they call that in medicine they call it the FOOSH. That's what fall on outstretched hand like this, like this. So this is what cause Colles fracture. So here's how it happens step by step. So we say that when a person is falling, they feel like okay, let me prevent my body from hitting the ground directly. So they use their hand to break it. So if the wrist is extended, bent backward at the time of impact, the force is transmitted through the palm into the distal radius. So the distal radius fails under this load, okay? Like it was too sudden, like it was too much for the hand to bear. Do you understand? So you have a transverse fracture about 2 to 3 centimeters proximal to the wrist joint. So the distal fragment is displaced dorsally, that's to the back, and radially. So this will now give it like your hand will look like what? A dinner fork. That's why they call it a dinner fork deformity. Okay, it's looking like a fork, like this. You know, the fork has like the teeth is like this, then bent down, then the handle is like this. So it's giving you are now looking as if it's actually what a fork that we use to eat. Okay. So key points, the main cause is usually what? Fall on an outstretched hand. Risk factor occurs more in elderly people, you know, and also people that their bones are weak. And also when you stay in places where there's slippery surfaces or spot falls, you know. So that's what we have for the Colles fracture. And the primary thing that could possibly cause Colles fracture. Trying to know the cause in depth.